Hello, everyone, and welcome to the second webinar in NEHA's Emerging Trends in Food Safety webinar series, concentrating on cannabis, regulatory and consultant perspectives to ensure food safety. My name is Laura Wilde, and I'm the Senior Program Analyst in Food Safety for the National Environmental Health Association. I'm joined by my colleague, Taryn Laird, Public Health Communications Specialist, and it is our pleasure to facilitate today's webinar. Please note this webinar is being recorded. If you are not okay with it being recorded, you may disconnect at this time. Thank you for joining us for our month-long observance of National Food Safety Education Month. We work to provide our members and the environmental health community at large with educational resources and tools to help support the EH workforce. This month, we are hosting free webinars every Tuesday on emerging food trends in retail food safety. Each webinar will be recorded and housed on our Food Safety Education Month page. NEHA credential holders can also self-report 1 hour of CE for each webinar viewed in the self-reporting feature of My NEHA. This month, we're also highlighting the outstanding work of our food safety professionals via our Food Safety Heroes blog. Food safety professionals across the United States and globally, for that matter, work tirelessly to safeguard the food we eat. To recognize a food safety hero, please tell us about them, and we'll shout their praises from the Food Safety Heroes blog. We'll put these links in the chat for your convenience. Today's webinar is proudly hosted by the National Environmental Health Association. There are countless benefits to becoming a NEHA member. You can connect with your peers, network, and get access to valuable resources and educational materials. We stand by our environmental health professionals who work so diligently towards a healthy environment for all. If you are not already a member, you can check out NEHA's website at neha.org to learn more. A bit of housekeeping before we hear all about cannabis. All attendees are in listen-only mode. As a reminder, this webinar is being recorded. Throughout the discussion, you may submit any questions you have in the Q&A box, and we will do our best to answer as many questions as time permits. I'm pleased to introduce our panelists today, Cara Leveaux and Cara Cronkite. Cara Cronkite is a registered environmental health specialist. She earned a Master's of Public Health in Epidemiology and Biostatistics from UNLV. Her bachelor's degree is in Food Science and Nutrition from Cal Poly San Luis Obispo. She has been regulating cannabis in the state of Nevada since 2015, beginning at the Department of Public and Behavioral Health in the medical marijuana program. Ms. Cronkite is currently the Chief of Inspection and Audit with the Nevada Cannabis Compliance Board. Prior to working in cannabis, she was a food safety specialist for Safeway, a health inspector at the Southern Nevada Health District, and also worked as the food safety manager for the Mirage Hotel and Casino. Cara Leveaux has an environmental health degree from Colorado State University and worked in Colorado health departments for 14 years before making the transition to private industry as a consultant. Her experience is in food safety, public health, and cannabis. As one of the first marijuana regulators in the country, where she worked for Denver, she has built a considerable knowledge base in the area of cannabis food safety and consumer safety. In her current role as consultant for LA Consulting, she assists and supports cannabis businesses with their compliance needs, such as helping them adopt and implement GMPs into their operations. She holds credentials as a certified professional in food safety from NEHA and as a certified quality auditor from the American Society of Quality. Welcome both Caras, and thank you for joining us today to discuss this important topic. Cara, the floor is yours.
Thank you so much, Laura. It's a pleasure to be here. It's always a pleasure to work with NEHA. NEHA is very near and dear to my heart as an environmental health professional, and that was my chosen career for many, many years. So thank you to NEHA for asking me to do this. We can move to my first slide. So I'm here to talk about cannabis and food safety. So this slide is just going to kind of kick it off and get us started. So I always like to talk first about the terminology that I'm going to be using in the context of my presentation, because the words cannabis and marijuana get interchanged a lot. Lately, some states and industry has determined that marijuana has a negative connotation to it, and so they've replaced the word marijuana with cannabis. However, during my presentation today, I'm going to be using the word marijuana to mean THC products. So the way I explain it is cannabis is really the overarching term. That's the sativa plant, the overarching cannabis term. And then under that, you've got hemp and marijuana, virtually the same identical plant. You know, the main difference obviously is the THC content, and the marijuana side of things is the psychoactive side. The THC is, you know, typically between 5 and 30%, whereas hemp, you know, by legal standards has to be less than 0.3% THC. Fun fact on the marijuana side, I was just reading the other day that all the marijuana smoked at Woodstock was 1% THC. So it kind of goes to show you how much this industry has evolved, how potent these products have become. You know, smokable marijuana right now is between 5 and 30% usually, you know, averaging like 12 to 20% typically. And of course, the concentrates, you know, those can be above 90% THC. So it's a, you know, leaps and bounds different from what folks were smoking in the 60s and 70s. It's crazy. A little fun fact there. Next, I like to go over just the legality because I'm going to be talking about both marijuana and hemp. So of course, marijuana is illegal federally and only legal state by state that has legalized it. So from a regulatory standpoint, marijuana, you know, when I was a regulator, was a bit easier because it was only in our state. So I'm here in Colorado. So when it came to marijuana, I only had to think about the boundaries of Colorado. Now, when it comes to hemp, though, hemp, you know, was legally federalized from the 2018 Farm Bill. So yes, it's legal to grow it, to make products, derive products, but it also operates in a hugely gray legal area because of the hesitancy of the FDA. So we still do not have, you know, GMPs or standards or testing rules or anything for the hemp world. So the hemp world, it's a huge booming market, but we're still operating in this very legally gray area because we're all waiting with bated breath to see what the FDA is going to do. So from a regulatory standpoint, when I was a regulator, hemp was much more difficult to kind of wrap your hands around because it's coming in your state from all over our country, from all over the world. So it brings up things like approved source, obviously. So we'll talk about that in a little while. So, you know, as a regulator, you know, why do we need to care so much about the cannabis industry? Well, it is a billion-dollar force, you know, both on the marijuana and the hemp side. It's a huge industry. So I was doing some research on stats, and the cannabis industry currently is worth $61 billion. That's just mind-boggling. So that is a lot of products being made. That's a lot of, you know, patient and consumer safety issues. You know, patients and consumers, you know, rightfully so, assume that these products are safe. And so as regulators, you know, we need to be stepping up and making sure these products are safe. What else? As we all know, the cannabis industry evolves really, really fast. There's a lot of competition in the industry, and so that drives very rapid innovation. So I started in marijuana regulation back in 2014 for the Denver Health Department. And, you know, that was just the very elementary stages. You know, we would go into a manufacturing facility and see, you know, ice water hash being made in a Maytag domestic washing machine. You know, yikes, you know, holy cow. So now, you know, fast forward, you know, to 2021, and a lot of these facilities, you know, hemp facilities included, have become huge, you know, large scale industrial manufacturing facilities with, you know, oodles of huge equipment. You know, I have a client here in Colorado, it's a hemp client, they operate 24 hours a day, 7 days a week, making hemp isolate. You know, the scale of their operation is mind-boggling how it's grown, you know, over the years. So, but, you know, mostly I'm going to be talking about food safety today. So as it relates to cannabis. So I always like to say, you know, it's just one extra ingredient, right? You know, what's the big whoop? You know, we're just adding cannabis to typical foods. So what's the harm? You know, where's the food safety risk in that? Well, it's an interesting thing, right? Because it sounds so simple. You're just adding one extra ingredient, but that extra ingredient makes it a really complex process because you're basically combining food production with a pharmaceutical that requires an accurate dose. And that's tough. That's tough to master. So of course, there's lots of similarities between, traditional food and beverage industry and the cannabis food and beverage industry when it comes to food safety risks. You have your sanitation issues, your personnel hygiene, your approved source issues, those are all the same, between both industry. Also the same is that cannabis is an agricultural commodity. And with agricultural commodities, there comes natural contamination risks. So of course, there's risks of microbes, there's risks of heavy metals, pesticides, that's the same as in other food industry too. So that's all the same. But one of the big differences in the cannabis industry when it comes to a food safety perspective is, your customer base, who's using these products. So that's where, as a regulator, I always cared so much about the cannabis industry because there's so many vulnerable people using these products. There's patients that are immunocompromised. They could be an older part of our population. They could be a younger part of our population. It's not just straightforward food production. You have to think about who the end user is and what their particular vulnerabilities could be. And that really makes food safety such a more important topic. So next slide, please. So I'm going to go over, my presentation is just some of the top food safety challenges that I've chosen. So this slide just kind of gives you a summary about them, and then I'll go into more detail on each one. So the first food safety challenge that I was going to talk about is just, the obvious one, the lack of federal oversight, the patchwork of regulations across our country. Other industries enjoy, GMPs and federal oversight. State health departments have the support of the FDA when it comes to food or dietary supplements or drugs. The cannabis industry is completely lacking that. So there's just such a disconnect. All the systems that work together to keep our national food safety, our food supply safe, we've got a disconnect going on in cannabis. And that's a shame for the consumers. Second is a lack of employee food safety knowledge. So, and I'll talk a little bit more on this in a couple slides from now, but, it's different than the food industry. I was an inspector for years, and there's a stark difference between a food facility and a cannabis facility. So when you're inspecting it under the same food regulations. So, not all cannabis people come in with food safety knowledge, so that, you have to work harder as a regulator with some of those businesses to get them, to understand and to learn some of these food safety ideas and concepts. The third food safety challenge I'll chat about is contamination. So when I was in Denver, I oversaw numerous recalls, probably about 40 for various things. We did a lot of recalls for pesticides, so contaminated plant material. And then we did a lot of mold and mildew recalls. So, that's definitely a concern for contamination. And then kind of tied into the contamination is testing concerns. The testing world is difficult, especially on the marijuana side. I firsthand saw a lot of sample manipulation, lack of sampling oversight, lab shopping. I'll get into some of that in a little while. And then probably the biggest issue that I see is unapproved source. So one of the interesting things I'll talk about today is some of the new isomers that are coming on market. Delta 8, Delta 10, THCO is a brand new one I just learned about a couple of weeks ago. So we will talk about that. It's a big loophole in the Farm Bill that the hemp industry has found. So we will chat on that. But let's dive into my first one. Next slide, please. So when it comes to a lack of standards, we have the lack of GMPs, and state by state, health departments, if the health department is involved, then that's fantastic because the health department has that public health background, that expertise, the food safety expertise to apply to this industry. But not all states are set up like that. So even in Colorado here, we have, really robust marijuana and hemp regulation, but our state health department will not touch marijuana because they're federally funded and they will not touch it. So even in Colorado here, so our state health department they regulate the testing labs, but they don't regulate the food products or the manufacturing facilities for marijuana. Now, our local health departments do, so at least there's some filling of that gap there. But my point is that, this is just an example of just the gaps in regulation and consumer safety across the country. So, each state is trying to figure out how to do that. And really, it's the health departments that kind of need to get involved because, marijuana, agencies that are formed to regulate marijuana typically do not come from a public health standpoint. They are typically law enforcement, or here in Colorado, it's under our Division of Revenue. They have more of a diversion and security focus. Of course, there is like public health and safety aspects to their regulations, but it certainly cannot touch like a health department's regulation or involvement. So that is, really one gap, big gap in regulating this industry. I think that's all I needed there. Oh, I was also going to mention, especially in the hemp world, also the same with marijuana. Some states have stepped up and written hemp regulations. Colorado just released theirs, and other states, New York, Michigan, there's lots of states, Missouri, that have hemp regulations, and that's fantastic. But we're still lacking that federal, like GMPs for regulations. And a lot of these hemp companies, they really want to be regulated. So a lot of them have gone out on their own and gotten third-party certifications for various things. They might get a GMP certificate or an organic certificate or just something. We're really seeing that a lot of these companies want to be compliant. And so they're, taking the onus on themselves and going out just to get some sort of certificate to say, this is how we're setting ourselves apart in our industry. We have a GMP certificate or an organic certificate, so on and so forth. So that's primarily what I do actually. Like we work with a lot of companies, helping them get some of these third-party certificates to help them stand out from a compliance standpoint. Next slide. Lack of employee food safety knowledge. That's definitely a big one. So like I said earlier, not all cannabis employees come in with food safety knowledge. Some of them, especially on the marijuana side, have come into this legal market now from the illicit side. And so they have, I used to see some of them had like an inherent distrust of regulators. So as a regulator, that's like a wall you kind of had to figure out how to break down and like try to build a partnership and really make them understand like we are on the same page. So, in a lot of facilities, they're just not used to being regulated, so that's a whole new kind of can of worms to try to figure out. And hopefully you guys all saw that Michigan recall. That was just really appalling. So I always like to tell clients, a license is a privilege, especially a marijuana license, because those are really hard to get. So if you guys didn't see it, I've got the link here in my presentation, but there was, I believe it was last month, a big recall in Michigan. The Michigan regulators issued a recall for a marijuana product manufacturer, both medical and adult use. And they were really doing appalling things, licking the pre-rolls, licking utensils, putting their fingers in ingredients and licking those, a complete lack of hand washing, a lack of PPE. It was really egregious violations going on in this facility. So it's kind of astounding, like as a regulator, some of the stuff that you see, but it really goes back to a lack of food safety knowledge for those employees or a lack of training. All right, next slide. All right, contamination and testing issues. See how I'm doing on time. Oh, I've got 5 minutes. I better wrap this up. All right, contamination and testing issues. So contamination, you've got chemical contamination of the plant material. That's always an issue. Pesticides, mold and mildew, aflatoxins are a big one. Aflatoxin comes from mold. It can develop from mold, and it's a known liver carcinogen. That's certainly not something you want to be smoking in your joint. That's a little frightening. When I worked for Denver, we saw a lot of really ethical issues going on with testing. So I'll touch on a couple of those. Testing is a touchy subject. So, as a consumer, you think, oh, it's been tested. It passed all its testing and it's great now. But, as a consumer, you don't kind of see all the behind the scenes complications with testing. So, we used to see intentional sales of contaminated plant material. Unlike the food industry, the cannabis industry, it's very high dollar stuff we're dealing with. So it's not as if, oh, we messed up our batch of bread, we're just going to throw that out. That's not the same mentality at all. You can't just, oh, we messed up this whole room of marijuana plants, we're going to discard them. No, they're going to do everything they can to save that room. So that could be applying illegal pesticides. That could be sample manipulation. I had one facility in Denver that also resulted in a recall, but we found out that they were manipulating all of their samples to pass the mold and mildew test. They were actually dehydrating them. So on site, it was appalling. I couldn't even believe it. They had a like Cabela's food dehydrator, like you would make beef jerky in, and they were taking each of their samples and dehydrating them for a number of hours before they sent them to the lab. So yeah, they were passing all of their mold and mildew tests, but they certainly were not dehydrating the rest of the batch. So that's straight up sample manipulation that is a horrible shame for consumers because they're buying tainted product. All right, next slide. Unapproved source. Unapproved source is also a big one, especially right now with the hemp world. So when it comes to unapproved source marijuana, not so much of an issue with unapproved source because, like I said earlier, you're only dealing with the boundaries of your state. So really unapproved source, that's not so much of an issue with a marijuana product. Now with a hemp product though, yes, it is. It's a big issue, especially with, all these products coming in from all over the world, really. Where were those manufactured? Is that coming from a licensed and inspected facility? In some cases, no. Not every state has a hemp program. My next slide will show that. But, also these new isomers are really concerning from a regulatory standpoint, quite concerning. So the 2018 Farm Bill, the hemp industry has found a bit of a loophole there. So it did legalize the derivatives of hemp. So if you don't know what Delta 8 and Delta 10 are, I'll give you a quick little lesson. I'm kind of running out of time, so I got to speed it up here. So Delta 8 and Delta 10 are newish isomers of CBD, but they are completely synthetic. So the hemp plant does have minuscule amounts of Delta 8 and Delta 10, but it would never be financially feasible to extract those from a hemp plant because it would cost way more to try to extract those than you'd ever make profit-wise. So they extract the CBD, and then in a lab or in someone's basement, who knows, they add acid catalysts to the CBD, and it's a reaction. So it's a reaction from the acid catalyst on the CBD, and it turns into Delta 8 and Delta 10, which are THC. Those are THC products, which is concerning. And then now the newest one is called THCO. THCO is 3 times as potent as Delta 9 THC. So that's concerning too. The concern here is that the manufacturers of these products are saying, well, wait, they're from the hemp plant, so they're legalized through the 2018 Farm Bill. But gosh, are they? Those are synthetic products. They're completely unregulated. Completely, they're being sold in 7-Elevens and Circle K's. I've got a couple of pictures of products here. So we've got gummy bears that are bright colors. They're shaped like gummy bears. Those have THC in them, way above the 0.3% that is allowed with hemp. So those are being sold all over. That's a concern. The next picture there is flower, and that is, in my opinion, kind of fraudulent because there is no such thing as Delta 8 flower. So what that is hemp flower that is being sprayed with Delta 8 oil. So, as a consumer, you don't know that. So anyways, I definitely could talk more about isomers, but I'm running out of time. All right, next slide. So back to my unapproved source. This is just a map that shows the whole country, and it shows which states have hemp programs, and it shows, whether or not those hemp programs also cover manufactured products. Next slide. All right, and then just a couple other additional food safety concerns. Solvent grade with the manufacturing facilities is a concern. There's different levels of solvents, and so if a facility is using the cheapest One, there could be impurities in that. They're all closed loop systems, so those solvents get used over and over and over. So solvent grade is the solvent grade is a concern, and also how well are those residual solvents being extracted. So solvents are a concern. Heavy metals from hemp growing. Hemp is a fantastic phytoremediator, and it just works wonders, to pull up contaminants from the soil. So heavy metal testing is kind of key right there. And then product innovation. This industry is really innovative. Some of these products are really like straight up medical devices, nasal sprays, suppositories, inhalers, eye drops. That's very different from, regulating those things as a food. Next slide. And then just to end on a positive note, because I felt like I talked about so many food safety problems, so ending on a positive note, what can your state do to strengthen the health and safety protection for patients and consumers? Well, when you can support the industry, regulation works so much better if there's a support and a partnership between the regulatory agencies and the industry. Provide food safety training to your cannabis workers. So at Denver, we had a free food safety class for cannabis employees that we put on every few months, and it was well attended and well respected. It was good. Develop public health regulations or require GMP certification. So I've got a couple clients in New York, so I'm quite familiar with New York's hemp rules, and they're requiring GMP certification to even get a hemp license. And that's really interesting because it really takes a lot of that onus off of the health department. So when the health inspectors show up to inspect, they already know that facility has a GMP certificate, which is darn hard to obtain. That takes months and months of work on that firm's end to get those certificates. So it's a great idea to work into regulations. Conduct plan reviews prior to licensure. That really heads off a lot of problems with sinks and product flow and employee flow through the facility. Require sampling oversight. A lot of states are requiring now that the laboratory come out and conduct the sampling. So that right there should take care of the problem of sample manipulation from operators. Don't allow testing allowances. That's not a good idea. And try to ban unregulated products. So Delta 8, Delta 10, a lot of states have banned those. And that's a good thing to do because it's an unapproved source. Next slide. All right, that's it. Thank you guys so much. Reach out anytime. Here's all my contact information. And it has been a pleasure. And I will check out the questions and answers now while I turn it over to Cara Cronkite.
All right, good morning or afternoon, I guess, depending on where you are. I'm going to briefly cover how cannabis is regulated in the state of Nevada. And just to clarify, when I say cannabis, I'm speaking about marijuana only. The CCB does not regulate hemp. Okay, so this is a list of all of our statutes and our regulations that we enforce. I have a team of inspectors that physically visit each facility at least once annually, usually more, and they conduct like your typical health inspections. And when the facilities are not compliant, we are able to issue civil penalties, suspensions, and we've even revoked licenses as well. There are 5 facility types in Nevada, soon to be 6. We just approved consumption lounges in this past legislative session. So we will start drafting regulations on those shortly. But we have cultivation, production, dispensaries, labs, and distributors. And I'll go over those in a little bit more detail in the next few slides. So what my staff does is kind of a little bit of everything. We wear a lot of hats. So we're doing the environmental health. We're looking at pesticides. We do conduct plan reviews prior to opening the facilities. We review packaging and advertising, equipment, menu. We investigate all the complaints, ownership, inventory tracking, you name it. There's really, we hand everything related to cannabis in Nevada is under our umbrella. So advertising, there's several limitations on advertising. We mostly respond to complaints or things that inspectors see when they're out in the field. Our main focus is to ensure that they're not appealing to minors and that they have the appropriate warnings on them. For our packaging, we do pre-approve all packaging. So if it hasn't come across our desk and we haven't given it approval, they're not allowed to use it. When it leaves the dispensaries, the packaging has to be reclosable as childproof. So no tear bags or anything like that. If you have a chocolate bar and you open the wrapper, you should have a bag that you can put it back into. You shouldn't be able to see the edibles inside the packaging. It has to be opaque. We don't want to encourage children to try to get into the product. Most food products, in my opinion, are appealing to children, especially what they make edibles into, you know, chocolate bars, gummies. And also the packaging itself can't look like a product that's typically sold to children either. So on the next slide, if you look at, you know, the picture's a little blurry, but it says Pot Tarts. And then there's all these different takes on common candy bar names that are infused with cannabis. These are examples of products that are made to look like food items that are marketed to children, and they would not be allowed in Nevada. So our cultivation establishments are the ones that grow the cannabis. They create usable cannabis. So on the left, you can see trim, and on the right is flower. It's often referred to as bud. Flower is typically sold whole, like in the picture, and trim they typically make into pre-rolls or send it to extraction. Cultivators are also allowed to collect kief. These are the resins that fall off of the usable cannabis. It's a very potent product compared to other cannabis. And then pre-rolls, these are typically referred to as joints. Pre-rolls just sounds more professional, I guess. Cultivation establishments have an environment that's really appealing to pests and microbes. If you have a lot of moisture from the plants and standing water, there's a lot of nutrients in that standing water from the soil and plant debris. There's a lot of people walking through with, you know, the high foot traffic areas, and the plants are frequently overcrowded together too. So if one plant becomes contaminated, and you have fans blowing around the room and people walking through the area, this makes it really easy for all the plants in that area to become contaminated. Inspectors are looking to make sure that the buildings are in a good state of repair. They look for things like holes in walls, which allow for pest access. And then on the right, you can see scrim coat on the ceiling peeling back, exposing the insulation. Those are things you don't want to, you want smooth, hard, easily cleanable surfaces. And then here on the left, you see floor sealant peeling back. On the right, the cement floor was never sealed at all. There's no base coving. There's just a lot of little nooks for pathogens to get trapped and start growing, especially with the high humidity environment. We check for any standing water buildup on any surfaces, including equipment. Here you can see what looks like algae growth on a tray table. So they're not cleaning as frequently as needed. Inspectors also look for signs of pest infestation and the pesticides that are applied to the plants. So here's a very severe spider mite infestation. They create webs like spiders, which you can see in this image. And once it reaches this point, there's really no saving the plant, although like the other Cara stated, they will try to. This next picture, I believe, is aphid larva. The plant's black because it died, not because of the aphids, but it just, with the black leaf, it really makes the larva very visible. And then this leaf, it just looks like it's really shiny, but in reality, it's white powdery mildew. And this is really, really common on cannabis. Inspectors also look for improper handling and storage of cannabis. So on the left, we see bare hand contact with usable cannabis. Our hands are not nearly as clean as we would like to think they are. We're all just a bunch of walking germ factories. So we don't allow bare hand contact with cannabis. And then on the right, there's really a lot going on in this picture. There were actually open personal beverages on the tables. These are balls of kief that were stored on a paper towel behind a computer, covered in computer wires, not protected from contamination. And then when we asked the worker what it was, the worker started explaining that they roll up the leftover residue from their gloves every day. And then the worker who collects the most, and then they were quickly interrupted by their manager who said, oh, it's waste, we're discarding it. So they're not allowed to mix batches together prior to testing. And there was just all sorts of violations in that photo. So we also verify that the cannabis is properly destroyed. They have to grind the cannabis until it's not recognizable and then mix it with at least 50% another substance. So here they're using soil, which is very common, but with this, they really have to make sure that the root balls are thoroughly destroyed. We have seen new cannabis plants growing out of dumpsters before because the root ball wasn't properly destroyed. They also use things like sawdust, kitty litter, really any type of waste is fine. Okay, and then so production establishments, these are the facilities that extract the THC out of the usable cannabis. They make concentrates, edibles, you name it, they're very creative. I'll go over some of the products they make. But CO2 and butane are the most common methods of extraction that we see here in Nevada. They also use rotovapes for ethanol extraction. We see heat presses where they press the cannabis together and the heat pushes the oil out, and even ice water to extract the oil from cannabis. I know Cara Leveaux was talking about this a little bit, but early on we were seeing washing machines in production facilities. And I thought, oh, well, maybe they're laundering their own towels. I peeked in and it was just full of cannabis debris. And that's how I learned about the process for bubble hash. So obviously washing machines are not allowed for that purpose. We require all equipment meets either food grade or laboratory standards for commercial use. We regulate production establishments just like we regulate a restaurant kitchen. They have a different main ingredient and a lot more laboratory equipment, but you still see the food grade equipment, the speed racks, the mechanical dishwasher, things like that. Every single menu item in Nevada is pre-approved by the CCB. We collect the list of ingredients and their procedures for making it, how they're infusing it even. We review those and verify that everything's safe for the intended route of administration. So some ingredients are gauze, generally recognized as safe for oral ingestion, but if you try inhaling it in a vape pen, then it's incredibly dangerous. So we look at the FDA and active ingredient list and verify the ingredient is safe for the intended route of administration. We don't allow inhalers, nasal sprays, or eye drops. And then vitamin E acetate is a great example, since you can eat vitamin E acetate, but you don't want to inhale it. And since we require pre-approval for all items, when there was the E Valley outbreak, we were able to look through all of our ingredients that had been approved and verify that our dispensaries were not selling any vape pens or inhalable items that contained vitamin E acetate during that outbreak. Production establishments make a wide variety of products. Gummies, cookies, chocolates, they're all very popular. I like this picture on the left because you can see all three stages of cannabis in one picture. You have the usable cannabis at the bottom. That gets extracted into an oil, or in this picture, canna butter. And then that oil gets infused into the cookie, which is the final product. This also shows each stage in which the cannabis gets tested. The labs test for different things at different stages, which I won't have time to get into today, but I'll talk about the labs a little bit more. They also make beverages. Beverages have to be reclosable, so they have to have some sort of lid so they don't have to drink the entire thing at once. We don't want to encourage overconsumption. Also, if they exceed 10 milligrams per container, 10 milligrams is our maximum serving size. So if the beverage is more than one serving, they have to have some sort of dosing mechanism as well. Usually like a measure spoon or a cap that you would see with like Pepto-Bismol or any type of medication. But it's just so that they can easily tell what a serving is. We also see a lot of tinctures on the right. These are actually designed for sublingual absorption. I'm sure you've all seen the videos of someone with severe tremors and they put a drop under their tongue and almost immediately stop shaking. This is because sublingual absorption is much faster than ingesting the product. It's almost instant, whereas edibles can take about 2 to 4 hours to have an effect. They get very creative. We've seen beef jerky even. That was very briefly before the USDA came and destroyed it all for an unapproved ingredient being the cannabis. That chapstick in the middle is just a joke. It really just looks like a normal lip balm product is what we see. And on the left, that's a product called Shatter. The first time I went to a production facility, it's probably about 2015. I'd never seen anything like this before. And I saw that on a sheet and I immediately thought Breaking Bad. I was quickly educated by the inspectors that no, I had not just stumbled into a meth lab. It is cannabis. It's just almost pure THC. So, and then we have capsules and all other products, but yes, they're very creative. So some of the things that we're looking for, the main thing that we're looking for is any imminent health hazards, just like you would in a restaurant inspection. We want to make sure that there's nothing going on that could contaminate the cannabis and lead to an outbreak. And anywhere on my slide where you see not an ME, we used to be the Marijuana Enforcement Division, and so we called them marijuana establishments, but now they're cannabis establishments. So anywhere you see not an ME, that picture is likely from a restaurant that I inspected in Las Vegas and not one of our cannabis establishments. So here we see raw sewage backing up from floor sinks. We look for pest infestations. So that picture is actually a little worse than it looks. Those roaches are inside of a gasket of a reach-in cooler that was storing food. If you look closely, they're multi-generational. So on the far left, you have an old roach, then a tiny little baby next to it. Then on the right, you have some, teenage roaches. This tells us that they're breeding inside the door seal of this cooler, which is a major issue because there's food right there. Proper sanitation is very important as well. This picture is underneath a deep fryer. The floors were so heavily soiled that I couldn't even tell what color they were. So I pushed it back an inch and discovered the floor was a terracotta-ish color. So you can also see stalactites forming from the fryer, just grease hanging down. All contact surfaces have to be properly sanitized. So if you look at the sanitizer bucket on the left, there's a few issues. Not only is this a food container being used to store chemicals and an unlabeled chemical, but some of you might recognize the color of that water. It's very similar to raw chicken juices, right? Well, that's because that's what was in the bucket. It was being used to sanitize all the surfaces, and it was just basically been used so much to clear off a raw chicken table that's what the water was, like a salmonella bucket. We also verify that all utensils and equipment are cleaned and sanitized properly. Sometimes it's difficult to tell whether we're looking at stains or buildup. So on the right, you see I wiped the container with an alcohol swab and the browning came up, so I could tell it just wasn't cleaned properly. We also need to verify that all utensils and products are stored in a manner to prevent contamination. Here's some utensils that are mixed in a container with pens and what appears to be some sort of bacteria soup at the bottom. We verify that all food products used as ingredients are not spoiled as well. So if your can is bubbling, don't use it. And we've seen all sorts of stuff. Like Cara was saying, there's not a lot of people in the cannabis industry that come from a food establishment background. And so we do require that they have in a production facility a food service manager certification, like ServSafe or equivalent. But you see the oddest things. So we had paint brushes that they were using to paint oil on food. They're also stored in a dusty bin. On the left, there's a lot going on. This is a bag of cashews, just so you can get the scale. Right next to it's a rat dropping. You can also see the shelf is chipped and pitted, so it's no longer easily cleanable. And there's just a lot of buildup on that shelf. Ice machines can build up a lot of mold or slimy mildew due to the low light and high moisture. So maybe order no ice next time if you're about to go have your lunch today. And then dispensaries, they are now called retail sales facilities. They're responsible for selling the cannabis. These are pictures of our actual facilities in Nevada. So they do look very professional. You don't really run into a lot of the Bob Marley beaded curtain type places like I've seen in other places. There's specific things that they're allowed to sell: cannabis products, devices to use the cannabis. They are allowed to sell hemp and CBD, and then they're required to offer for sale lockable boxes like you see in the picture here. They are not allowed to sell, though, food and other beverages that don't contain cannabis. They're not licensed as a retail food store, and they should not be operating as such. So in dispensaries, we really look for all the same things previously mentioned. Mostly we see unlabeled chemicals, lack of air gaps at their floor sinks, things like that. Here we see items for consumers in the fridge, those boxed containers are products for sale. They're commingled with personal items. So in the door, there's people's lunches. So also this isn't a commercial grade refrigerator, and so it shouldn't be used for anything other than storage of personal items. We look at storage issues. Everything has to be at least 6 inches off the floor so they can properly clean under it. You don't want a lot of clutter. That leads to pest harborage conditions. And we do allow repackaging at dispensaries, but it has to be done in a pre-approved area. So here you can see cannabis being repackaged in an office with carpet and open beverage on the desk. They just stuck a cutting board on their desk and a scale and have some isopropyl alcohol out, not even actual sanitizer. So this room was not approved for repackaging. And then the labs are responsible for testing the cannabis. So this is a picture of inside one of our laboratories in Las Vegas. And there's too much going on here in the labs for me to cover, but they can't have financial interest in another cannabis establishment. They have to be totally independent. They are inspected just like a clinical or environmental lab. We have a specialized team of inspectors that inspects nothing but laboratories. Laboratories have to be accredited, ISO accredited. All methods are validated. We look at potency, inflation, controls, following their SOPs, and just a lot more. I really wish I could probably spend an hour talking about what the labs are responsible for. They're really the gatekeeper of the industry, because if they're not doing their job right, everything else is just canceled out. But we do require that the labs are the ones that go out and collect the samples at the facilities. They have to be presented with the entire lot of the product. And then they take a representative sample from that lot. We have limits on the minimum amount they're allowed to collect to be considered a representative sample as well. Okay, and so the cannabis, I'll just talk a little bit about CANRA. That's the Cannabis Regulators Association. This is a national organization of cannabis regulators that provides policymakers and regulatory agencies with the resources to make informed decisions when considering whether or how to legalize and regulate cannabis. We meet at least every 6 months and we discuss major issues. We also have a lot of subcommittees where we tackle more difficult issues within specialized teams. There are subcommittees for lab testing, licensing, emerging trends, research, a whole lot more, background checks, everything we have a subcommittee for. And then those subcommittees sometimes have subcommittees as well. We look at things like, what are all the states testing for? So right now, one of the big things we're doing is we're comparing all the testing requirements of every single state that has legalized cannabis. And we're looking at the differences and if maybe some states are over testing or some states aren't testing for enough. And we're just really trying to create best practices. We have members from 33 states right now, and it's always growing. It's actually really, really helpful to us. I think all the states, but especially, really hearing about it's helped us a lot. Like Cara said, cannabis is still federally illegal. And so we don't have any FDA or other federal guidance to rely on. And so we really rely on each other for direction. I also included a link to our website where you can find FAQs, newsletters, resources, all of our laws and regulations. That's ccb.nv.gov. There's a lot of different, if you click on contacts too, there's a lot of different email addresses for general questions. If you have questions about licensing, there's a licensing one, and so on. And then there's a lot of great books on cannabis as well, but the American Herbal Pharmacopoeia is really a great resource for regulators as well. I highly recommend that, that piece of work. And if you have any questions or want more information, you can send an email to auditinspections@ccb.nv.gov, and that will most likely make its way to me. Thank you.
Great. Thank you, Cara Cronkite and Cara Leveaux, for your excellent presentations on cannabis and the food safety of cannabis edibles. I think this has been really valuable. I've learned a lot from you, and I'm so grateful to have you on board. Now is the time where we open it up for questions. So we would love to hear from our audience. If anyone has any questions, you can put them in the Q&A box at the bottom of your screen, and we will happily go through those questions and get some answers for you. So I do have a first question, initial question for you, Cara Cronkite. Do you have specific training and or education requirements for the regulators that inspect the cannabis edibles facilities?
Yeah, so we do require that all of our inspectors are registered environmental health specialists. So that's one thing. We also do some training. We get them certified through ServSafe as protection managers. And then a lot of their training is really just shadowing the other inspectors, and I'd say we're always training as well, because this industry is so creative and it's just always evolving. And so our training never really ends, but they go out in teams as well. And so they're always kind of learning from each other as well.
Got it. Thank you. The next question I have is for Cara Leveaux. Cara, working for a consulting organization, are there some resources that you might recommend? I think maybe some of our audience members might be people that are about to regulate or that currently regulate, or maybe they're in the industry themselves. Do you have some recommendations on resources where people might go to get really great information, things that you've come across in your many years of involvement in this industry?
That's a great question. Let's see. I mean, I'm trying to think like what I use mostly as resources right now. Like I said earlier, a lot of our clients are seeking GMP or organic certifications. So we've become quite knowledgeable with, different state rules on hemp regulation or so on and so forth. And then we also work with a lot of certifying bodies. So there are certain certifying bodies out there that will certify cannabis businesses for GMP, such as, let me think here, Perry Johnson or ASI or ASTM is getting a lot of press right now because their D37 committee is coming up with specific cannabis GMP standards. So that's exciting that one's on the horizon as well. Because before that, the hemp industry especially was just trying to use CFR 111 or CFR 117, and they don't really neatly fit in those boxes. So I look at those standards a lot for those certifying bodies. I use that a lot. I'm trying to think what else I use. I might have to think on that a bit more, Laura.
Yeah, no worries. Put you on the spot there. I have a follow-up question to that. What is the GMP certification? And the secondary question is, what certifications do you tend to steer facilities towards as well?
Great question. So a GMP certification is a third-party agency that comes in and audits your facility to GMP standards. So it's better for cannabis companies to go with a cannabis-specific standard, and I can talk more on that in a minute because it encompasses all of their products. So this is primarily what we do. We help clients become GMP certified. This process is long and lengthy, and it takes most companies about a year to implement all of the SOPs and the documentation, all the data collection. It's a heavy lift because it's a complete culture shift with how that manufacturing business or that, it's mostly manufacturing facilities that want these. So it's a complete culture shift with how they operate. So it's a ton of documentation. We coach clients that if it is not written down, it did not happen. So it's a lot of documentation. So there's lots of SOPs, there's lots of logs. So a company takes a long time to kind of implement all of this and get all those systems running. We basically create an entire quality management system for them. So it incorporates all these different quality management systems, like a corrective action, preventive action plan, a recall plan, consumer complaints. There's an improved supplier program. I'm trying to think, cleaning and sanitation. All these things work together to form your quality management system. And it basically ensures that your company is creating quality and consistent products every time. So it's a very methodical way of thinking. So it's a heavy lift for a lot of companies. So for a company to really get a GMP certificate, that really is saying something, because that was a hard thing to get. So that kind of goes back to my point why I'm really excited that some agencies in some states are requiring GMP certificates, because it really takes a lot of the onus off of the regulators. So it's kind of, because it just puts it at a different, it puts that facility that has that certificate at a different playing level. I can't remember if I was going to talk about something else. Does that answer it?
It does, yes. And it's so interesting that you say that, because earlier in one of the Cara's presentations, excuse me, I don't remember which, but you were talking about having people that aren't necessarily food safety familiar. You know, these are cannabis experts and they've been doing this operation and now they're entering the food safety world. So they have to come into compliance with different regulations and different requirements that they might not have ever seen or heard of before. So I could imagine that would be a very big challenge, especially in the absence of federal oversight and guidance documents and model regulations and things that other industries have really benefited from over the years.
Right.
So,
yeah, really, a GMP certificate is kind of the business's way of saying, we are going to prove to the world that we are compliant, and here's our certificate. You know, so it's kind of a way to set that business apart, because especially the hemp industry is so crowded. So some of these companies need some method of setting themselves apart, and they're using compliance to do that, which I think is great. Love compliance.
I love compliance too. So I have another question for Cara Cronkite. We saw a lot of health hazards in your slides. How do you handle those? Are they more in line with regular restaurant violations, or are they subject to more strict requirements? And does your team do anything to help educate workers in these facilities on food safety education?
Great question. Yeah. So a lot of the pictures that were in my slides are not from cannabis establishments. They just haven't been open very long, you know, maybe 5 years and 6 years, maybe at the most. And so they haven't really had the opportunity to get to that point for the most part. But what we're really focused on is preventing those situations. We do a lot of education to make sure that they know that that's the type of stuff to look out for. We allow for self-reporting so they can tell us if there is an incident in their facility, rather than us just finding out later, because we do have 24/7 video surveillance in all the establishments. We allow them to tell us and tell us how they corrected it. So that really encourages being proactive rather than reactive. I would say we're a little more strict than normal restaurants. You know, we don't just give an A, B, or C grade. We do suspend the license or close them like you would a restaurant. We issue suspensions, but sometimes they'll go on for 30 days, whereas a restaurant usually can fix everything in a couple days. We also issue hefty fines. So these are called civil penalties. You know, I mean, there's been some in the $1 million or like hundreds of thousands of dollars. We collect millions of dollars for civil penalties just because they are very serious offenses. And so, you know, you add up, you have untagged plants and, you know, different violations like that where we can't tell where your product came from. One of the big penalties for them is making them destroy the plant. So that's really hard for the facilities, usually harder than any civil penalty or a suspension is saying, hey, all this hard work that you put into growing these plants, well, we don't know where they came from and we don't know where they're going. So you have to destroy everything. And that's months and months of work. And so that usually hits them the hardest. And so failing tests, you know, everything gets tested. If we require stuff gets destroyed, that's really their biggest motivation to operate in a compliant manner, I would say.
Great. Thank you for that, Cara. Very, you know, just really interesting topics today. And we are nearing the end of our presentation. Unfortunately, I feel like we could all chat about this for much longer than we have today. But before we go, I want to remind everyone that the third webinar in our Emerging Food Trends webinar series is coming up next Tuesday. So join us to learn from 3 different organizations on how they're helping to support safe food during third-party deliveries. So I'll drop that link in the chat for you all as we proceed. I sincerely thank you, Cara Leveaux and Cara Cronkite, for your valuable time and insights on today's webinar. And of course, thank you to the attendees for their time and participation and dedication to food safety. Don't forget to tell us about your food safety hero so we can sing their praises on our Food Safety Heroes blog. And thank you all for your time. Thank you, Cara and Cara, and we will see you next week.